Alrighty. Hi everyone, my name is Jessime Kleelup and I'm the Director of Pre-Pharmacy Programming. I welcome you all to the 12th Annual Pre-Medical and Pre-Health Professions National Conference. I would like to thank all of the student volunteers and of our sponsors, especially the AAMC, without whom this conference would not be possible. I'm excited to present you all our first keynote speaker, Dr. Kathleen Hill-Besinque, who has been with us for a second year. She's the president of the California Pharmacists Association and an associate professor of clinical pharmacy and the assistant dean of curriculum and assessment at the University of Southern California. She is also the director of Professionals Experience Program, IPPEs and APPEs at the University of Southern California School of Pharmacy. Without further ado, let's give a warm welcome to Dr. Kathleen Hill-Besinque.
Well, thank you very much and good morning. It's a pleasure to be here. It's always a lot of fun to see excited new faces interested in pharmacy. I'm a big advocate of pharmacy myself, obviously. I have a couple of slides to share with you, and I also want to talk with you a little bit about my career path and why I chose pharmacy. And I'm happy to answer questions as well that you might have. I think to make this presentation the most valuable to you, it's important that I address your questions and make sure that you're getting from this program what you need. So I started here with a word cloud. These are words I think about when I think about pharmacy applications and where you are in this process of applying to pharmacy school, thinking about the profession. And the take-home message that I have for you today is that pharmacy is in a time of change. Pharmacy is not unique. I think if you've been to other keynotes at this conference, you've heard the same theme over and over again. Times they are a-changin'. And probably the best advice I can give to you as you embark on a career in health professions is to be cognizant of the changes that are out there. Be flexible in your mindset, because things are not going to be the same. That's the only thing I can tell you for sure. The healthcare system itself is changing. I'll talk about what some of those changes are and how they impact pharmacy in my interpretation. Pharmacy practice itself is changing. Many of you may be aware of some recent legislation and legislation that may be forthcoming that affects the practice of pharmacy, and I'll touch on it just a little bit and tell you why it's important to me. And probably most pertinent to you at this point in time are changes in pharmacy education, because those are the first changes that are going to touch you as an applicant for pharmacy school. So let's talk a little bit about healthcare. Healthcare is changing in a number of ways. Over the last few years, the mindset about healthcare has shifted. It's shifted from being something that's nice and something that you earn, perhaps, but it's also something that shifted into a right. People now are starting to understand that healthcare and access to good healthcare is fundamental, and it's a cultural change. And that impacts far more than just the profession of pharmacy. It impacts everyone. As more patients and consumers begin to accept healthcare as a right, their expectations for their healthcare are going to change. And it's going to be a good change, I think. Technology is changing practice. For a long time, pharmacists have been involved in working with computers. We've been pretty techno as far as, I think, health professions go. But technology is really changing, not just as a tool, which is how it's been used in the past. It's the way we get things done. We use technology, but it's now actually becoming a driver. It's driving practice. It's changing what we do and how we give health care. Instead of it being a tool that helps me fill a prescription or monitor a patient in a healthcare system, now it's helping to improve practice. We can collect data. We understand now in a much bigger way how our decisions affect health. We can use technology to remind us while we're in practice, oh, maybe you should check the patient's kidney function if you're going to use that medication. Or maybe it's been a while since they had their last eye exam or foot exam. That's a big change, and technology is helping us do that. We talk a lot about the electronic medical record, that giant place in the cloud where all of your health information would be stored. I think that's a ways off, and it's an ideal, and we can't let ourselves stop what we're doing and wait for that to happen. We have to use technology as we have it. The Affordable Care Act. How many of you are familiar with the Affordable Care Act? Oh, good. The Affordable Care Act has made huge changes to the practice of healthcare, and I think they've been very good for pharmacy. As we are giving healthcare to more and more people, we are beginning to realize that the physician supply that we have is not adequate to meet that demand. And perhaps the physician work supply or workforce isn't always the best person to do the job. And I think that brings huge opportunity for pharmacy. We are experts in medication therapy. We understand our patients, and we understand the drug therapy. And because drug therapy is one of the biggest types of care provided, and certainly with chronic care, medications are an enormous part of healthcare. We're in a great spot, but we have to step up. You may or may not have heard a lot about being a provider, and I'm sure other speakers will address this in a little bit more detail, but being a provider has been a barrier for pharmacists, or at least there's been a perception that it was. In some areas, we aren't designated in the right category of healthcare provider for us to be able to bill or be paid, essentially, for our clinical services in managing patient care. There's a bill going forth in Washington. I hope that you have time to break away from your studies and contact your representatives and make sure that your voice is heard. It's important that we expand our role and be designated properly for us to continue to provide the care that we do. On that note, the provider change for status change for pharmacists in California was enacted last year in October. When I came last year, we were very excited. We had just passed this legislation, and things were very exciting in pharmacy. And I want to say that although we don't have a bill that's that big this year, we're still doing a lot of work on enacting the practice changes that were signed into law last year. California is hoping that other states will join us. Some of the things that we have done are, I think, pretty novel. Other states have also enacted changes in the practice that help pharmacists provide the care that patients need. These scope of practice changes have been an evolution. When I was in pharmacy school, the exciting thing that was happening actually was that pharmacists were going to be consulted and be allowed to engage in collaborative practice. And I remember how excited I was at the time. They were doing studies. There was a bill that would allow pharmacists to write notes in the chart and manage drug therapy under collaborative arrangement with physicians. And while this was primarily going on in long-term care and nursing home facilities, there was great promise that this would spread to the hospital. And I'm so happy to say that that has not only happened, but it's gone even further. Now we're engaged in this collaborative practice arrangement in every aspect of healthcare, from indigent care in clinics all the way to acute care in intensive care units to home-based care. And that's it's been a slow evolution. but it's been really great for the practice. One of the things that is new for California is the advanced practice category of licensure. How many of you have heard about advanced practice licensure? Not as many hands. This is an exciting development for the practice of pharmacy. In California, the exact regulations are still being developed, but this will enable pharmacists to expand their role in the management of medication therapy. One of the challenges for us as a profession is that this will also create some increased opportunities / challenges for postgraduate education. Because one of the key components of this category is completion of a residency. And while there are avenues to getting to this advanced practice category without a residency, they're more challenging, and the number of residency slots at this point in time is not adequate to meet that demand. So we do have some challenges, but we have opportunity as well. What about education? There have been a lot of changes in the educational pathway for pharmacists. I'm sure all of you are aware that the Doctor of Pharmacy is the entry-level degree for the practice of pharmacy. That is something that took 50 years to come into being, from the first schools that offered the Doctor of Pharmacy to when the entire nation started doing it. So some changes are a little bit slow. Another change that you may have heard about is the increase in the number of pharmacy schools. So how many of you are concerned about that? Okay, so let's talk about that for a minute. There are more schools, there's no question about it. And there may, in fact, end up being more pharmacists. I think that that's a fair thing to say. But in my opinion, that makes it a great time to go into pharmacy school. And you might think, this lady is nuts, right? What's wrong with her? Well, I'll tell you why. As a student, an increase in the number of schools means you have more opportunity. You have a chance to look at a number of different schools and go where you fit in. Go to the school that meets your needs. Go to the school that's going to give you the educational experience that you want. You can be confident that regardless of which school you choose, there are national standards for accreditation, meaning that the quality of your education is monitored nationally. And the quality of your education does have some pretty reliable standards. So that said, you've got a lot of opportunity. You have many schools to choose from. And I encourage you to continue doing what you're doing today. Come, investigate the profession, investigate the schools, do your research, do your homework. Make sure that you select the school that's going to give you the opportunity, the opportunity to practice in the way you see. I think it's a good thing that we're producing more pharmacists. I think it's going to help the profession grow. If everyone who graduates from pharmacy school all the time, regardless of whether they're at the top of the class or the bottom, is functioning at the same level, there's no growth for the profession. By having a large number of graduates, there's a lot more opportunity for those of you who want to embrace the profession and do great work. I want to see a little bit of competition. Competition makes us all better. If there's no competition, we might just get lazy. We might not be inspired to do our best work. And so I don't really see the increase in the number of schools as being something that should cause great concern for those of you who are interested, motivated, and want to engage with the profession. I see that as a sign of opportunity. In your education, there have been some changes in accreditation that will affect your education. When I was a student, I had maybe 6 rotations, all of them really in my last year. Didn't really ever get out hardly to a pharmacy until I was almost ready to graduate. I actually worked at Disneyland. I did. I worked at Disneyland when I was a pharmacy student. Now our educational process requires that you are engaged in practice from early in your pharmacy school all the way through to the end. It's a third of the curriculum. I think that's a great change. It creates a lot of opportunity, and it will make pharmacy a much better, more skilled workforce, ready to help patients and the healthcare system. There's an expansion in postgraduate training. You heard me touch on that when I talked about the advanced practice category. Postgraduate training is something that is very mainstream. When I graduated, there were 150 residency programs in the country. I did one. I fell into it. Honestly, I didn't know anything about it when I was where you are, and I admire you all for doing a lot more research than I did when I was a student. I actually found a brochure on the ground, and it talked about how great pharmacy was, and I thought, okay, maybe I'll do that. But the times were different then, and I guess I was not as thoughtful as you, but the postgraduate programs now are in the 2,000 to 3,000 category, and I'm hoping to see that increase so that there are residency opportunities for every student who wishes to engage in it. Residency, for those of you who aren't aware, is a 1 year after you graduate program that is intended to give you practice skills that exceed what you got in school and what you could get on your own. It's a really great experience if you're interested in furthering your education and engaging your profession at the highest level. I wanted to sort of end on another word cloud. I'm into word clouds this week. Kind of think it's fun. But I would like to encourage all of you to continue with your path of research into the profession of pharmacy. I think it's a great profession. If you were to ask me, would I recommend it to one of my children, I can honestly say yes. I have a daughter who's a pharmacist. She graduated from pharmacy school almost 3 years ago. She did a postgraduate residency in primary care, then in management, and she's happily employed in pharmacy at this time. It's a good career. I think it's going to provide great rewards for you in the times ahead, because although things are changing, I think they're changing for the better. And during any time of change, there's always that little worry, oh, is this going to be okay? And my opinion is, yes, it is. It's never going to be better. So thank you. If you have any questions, I think I have like a minute left. I can answer your questions. Are you awake yet? No questions? Yes?
Because pharmacy isn't like medical school, how do we get kind of our pharmacy, like, we're volunteering and like how do we get experience for like volunteering for internship?
So once you're in pharmacy school, I think pharmacy school is better than medical school in one way, and that is that pharmacy students are licensed. So you have a scope of practice, you're licensed in California, you have things you can legally do, you can volunteer, but in many cases you can also get a paid experience where you get paid to do what a pharmacy intern or an intern pharmacist can do. Before you go to pharmacy school, I would encourage you to volunteer. If you have a Care Extenders program through your college, that's one good way. If you don't, you may want to contact a hospital. If you want to get into pharmacy specifically, you may need to look for independent pharmacies, you know, kind of a mom and pop store. Those usually provide the best opportunity to get in and see what happens in pharmacy. You get into a chain, it's a little corporate, there's red tape, you know. But I would encourage you to engage and not be afraid to look not only at pharmacy, but look at what the other health professions are doing, because that will help you in your practice forever to understand where these other healthcare providers are coming from, how they operate, what they need. It'll make you a better pharmacist. Any other questions? Okay, well, I thank you, and I wish you the best of luck.